Let's start.
I love advocacies. Advocates to me are the bridge between doctor, patient, and insurance company. Being a breast cancer survivor, and because I speak publicly on breast cancer as well, both for I've done it for big pharma, I've done it for individual groups, advocates. To have someone break down that information of this bullet into something that are tangible pieces that I can understand is it. And for various things, there's advocates for breast cancer, there's advocates for diabetes, there, you name it, there's an advocacy out there for it. I do it, I speak to patients, they can speak to me on any foot problem from talks with Dr. D and also on breast cancer. What does this look like? What did this doctor say instead of want? Because a patient is only as good as what they understand. It's the same thing if you do a consent to do a procedure. If I say we're going to do an amputation at the level of the at the Chopard joint, you're like, what? Versus saying, we need to take this part of the foot off at this section of the foot because your circulation is poor and you have changes that show that you have dead tissue. Now you get what I'm saying. So translation into layman's terms is a big thing. And I think advocacies do that well. I think that the responsibility is for the physician, obviously, to translate what they're trying to do. But there is a patient responsibility to know that whatever condition you have, there's an advocacy group out there to support you.
Definitely. And that's good that you said like meeting people where they are, correct?
Meeting
And
people where they are. I mean, you can talk to me. If you talk to me about something, I don't know, about a car, I got a basic understanding, but if you go higher, I'm like, all right, but if you break it down to me where I'm like, oh, that's what that means. Okay, well, yeah, let's get that fixed. It doesn't matter what the subject is. Can the person understand what you're saying?
I love your social responsibility with the people. And one of the things perhaps that needs to improve is the trust between big pharma corporations and the public.
Mhm.
What can be done better to make sure that, and like you said, this is like a cycle, right?
Mhm.
What can be done better so people can understand that this is a business, but at the same time that these individuals, that the executives, the CEOs are making the best choices for the people, but also like you mentioned before, that the advocacy also comes from them, not from also outside organizations. So in your expertise and in your knowledge, what do you think can be done better in that aspect?
I think there are a couple of carryovers. So you want you testing versus assumptions. Business need metrics, and we have to be better at that as the physicians. We have to be better at that as the insurance companies or big pharma or pharmaceutical companies or whatever you want to call it, even pharmacies, to see that what metrics are presented, realizing that it's iteration over perfection, realizing that one does not fit all, and allowing for nuances based on the patient and supply and demand, supply chain reality, understanding the logistics of coverage, and if outcomes fail, what can you do or adopt that's different? What's a new invention? What's new that you can change? Life is inevitable, it's cyclical, but at the same time change is progressive. So if something's not working, what can we do to make it better? I think having health equity in those, um, for big companies is important to help translate the physician language and to help translate the patient language. So instead of fighting each other, we're now working together.
Definitely. And then this comes with accountability. And you said something, there needs to be an accountability beyond the fines,
Mhm.
because that's how the public will start also trusting a lot of other companies, because now they're being transparent when they make a mistake. You said it yourself, as a medical doctor, not everything is 100%, not everything could be perfect. But when we assume a responsibility and we take accountability of those little mistakes we make, it makes a huge difference because it brings transparency. Um, in the field of connecting with the public from a corporation, and you do a lot of advocacy, what could be done better for that transparency, that accountability part?
I think incentivization is always a good thing. Incentivization where you want to do better. What does it look like? What does it look like both for the patient and for the doctor, right? Hey, I know if I see my doctor and I have my hemoglobin A1C checked every 3 months and it stays under 7, now the insurance is saying that they give back, a $50 gift card. Ooh, I can go buy some shoes with that. Great, sneakers. Hey, now with that, my patient is consistent in coming in and I'm not looking for the patient. Oh, you know what, patient? I did tell you that your hemoglobin A1C is under 7, but you may have this. Let me be transparent that even because it's now 7, but you've had it at 12 for so long, these are the things that we're also looking at. So the patient's not upset. What you mean? It's at 7. What do you mean? But I've been telling you along the way, we've been watching your kidneys. You see how now it goes? Hey, I got this patient's hemoglobin A1C down to 7, insurance company. What else can they do? Oh, you're giving them now because they're 65. They can also go to the gym for free. Okay. Hey, patient, go get cute. Go and work out at the gym. Use that money and buy yourself a nice cute. You see what I'm saying? When you personalize medicine, but you're still looking at metrics at the same time. Hey, the patient was on they were on a GLP-1, which was approved, the Ozempic, and now they've lost 30% of their weight in addition to the fact they're at the gym and now their blood pressure is normalized. Metrics. Hey, fill out this survey in terms of the fact that this insurance company got you to go to the big gym and what was your experience? Yes, I brought 3 more people to the gym with me because of this experience and told them they should sign up with this insurance company.
I love what you said, because now the patient doesn't become a statistic or experiment. Now they become a motive of celebration, right? Now you're embracing their victory as much as you're embracing your data. And I
Mhm.
think everyone wins in this aspect. I think that was a
Everyone
brilliant.
wins. The insurance
Yeah,
company's happy because they're getting what they need to get, and you reduce the cost. Reducing cost, part of it is making the patient healthier, where you don't need to be on all these medications, correct? Or using the medication appropriately and showing the data in terms of what's the outcomes. Where the now with these different medications that they can say, yes, this is why the insurance company should cover this because look at patient A, B, and C. Look how well they did. And the doctor's happy to prescribe it because they're seeing that they have a happy patient and it's actually working for them, staying on this medication, reducing, for example, GLP-1s reduce inflammation as well as keep your blood sugar controlled. So I think that's big that we're having. It's a circle. It's not boxes. It should be a circle.
yeah, and by the way, for the public, Dr. Kordai is looks amazingly young, but she has a lot of experience. Let that face not
Wait,
fool
wait,
you.
wait. You trying to tell my age? Women don't
No,
tell
no,
their
I'm not
age.
gonna. I'm not gonna display
I'm Gen
your
X.
age.
We'll leave it at
But
that.
let me tell you, she looks really young. Everyone that is gonna look at this, gonna be like, is she talking out of all this experience from where?
Yeah.
Like she look.
I've been out of practice now for about 21 years and I'm Gen X and we'll leave it at that. The lower end of Gen X, but Gen X.
Her age becomes a mystery, guys. Let me just tell you that. But she looks amazingly young. If you see her in person, you'll be like, she just came out of like college or something. Like
That's
she
going
looks
to the
amazing.
gym. That's trying to eat well, even though I like chicken wings and on all the empanadas and things that we were eating the other day. But and faith, peace, meditation, and good health, good medicines and good doctors.
Before I go to the niche, your niche expertise was it, which is podiatry and also footwear technology.
Mhm.
I wanted to ask you, obviously, because you know about medicine and you know also what food can do to you. How do you feel like after you eat like a like a good meal that you say like, oh my God, this was worth it? And like, okay, yeah, I know this is not healthy, but at the same time, I'm enjoying life. How do you go about that? And what would you recommend for those that are, trying to keep their weight, and because they know they have ankle problems and foot problems,
Mhm.
but is it okay to have that cheat day?
Well, you have to live life. I mean, they're a purist. My mom is probably one of the best people. When she knew she had cholesterol, my mother eats fish. She's a pescatarian and loves salmon. And I admire her because I'm just like, I cannot eat salmon like that. But it's good for her health. She's in her 70s. She looks great. It's helping. She's had, health challenges and she's doing very, very well. She can help my father, who sometimes will complain, but is very grateful. He's 81 and he looks amazing, doing great. And people are like, those are your parents? I said, so eating is the backbone of good health. It really is. Now, do I enjoy a good meal? Absolutely. And I think that there should be the 80-20 rule. We hear about it all the time. So some people say, well, 80% of the week, I'm going to do this and leave it to the end of the week. Some people say 80% of the day, I'm going to eat well, and 20%. That's where I would say that's between you and your health provider. But I do think there should be a balance. Food is yummy. Food gives energy. Food sustains the body. We unfortunately, some of us look at it, we have emotional ties with food, which is why you have a lot of healthcare companies that have nutritionists, dietitians to help us get on the better road of health and healthy eating. But I definitely like a good meal. I mean, we were in West Orange, and West Orange has fabulous restaurants. So yes.